Well, here in Connecticut, there were 106 new COVID-19 cases reported. Hospitalizations also increased by 1. There were 8 new COVID-19 related deaths. There were more than 12,000 tests performed, and our positivity rate remains below 1%. As our curve in Connecticut flattened out, hospitals worked hard at getting the word out that they were open for people and they are safe. Joining us to get an update is Dr. Ajay Kumar, Chief Clinical Officer with Hartford HealthCare. Dr. Kumar, welcome back.
Thank you.
What is the current update across Hartford HealthCare as far as COVID patients?
You know, I think our Hartford HealthCare, just like Connecticut, is doing really well. We have 14 patients today we are treating across our 7 hospitals as of this morning, and I think none of them are in ICU, which is wonderful news. We've seen a significant decline in hospitalization, and obviously our community is doing well. As you indicated, the infectivity or positivity rate of the testing is rather low at the moment. It's all a good sign at this time.
Many patients were fearful going into the hospital. They feared exposure to COVID. What are you seeing now in terms of volume? Are patients coming back?
Yeah, it's a great point. I think in the early on, in late April and early May, there was a significant amount of concern, and rightfully so. Actually, I think there was our community spread was quite rampant at the time. With all the measures we've taken collectively as a society, as a Connecticut residents, and especially the hospitals, I think we've come a long way. Let me talk about Hartford HealthCare. I think our team, colleagues across the system, have done a tremendous job. We really have created a very COVID-safe environment for individuals. We have obviously all those processes such as travel ban for our colleagues, our screening process, temperature screening, all sorts of measures in place right now with supply of the PPE, which is very good at this time, testing capabilities. We have seen a return of the patients. The patients are coming back. Our EDs are seeing about close to 80% of the volume back right now. Our inpatient operations and surgical volume has come back very good, close to 95 to 97%, so it's in a good place. And I think this is a testament of all the hard work we have been doing for several weeks now to make sure we instill the confidence in the community that we are ready and safe. And we have proven that we have seen no adverse effect or community or hospital-acquired infection at this time. We monitor these things very carefully. Our commitment has always been safety, and we're going to continue to do so. So I'm really proud of the colleagues' work across the Hartford HealthCare to get where we are right now.
Excellent. And one last quick question. With flu season coming up in the fall, are you still expecting to see a resurgence?
Yeah, so I think that's a great point. And this is something we all have to be cautious at this time. I expect that we would have some amount of surge happening sometime in the fall and the winter, probably more so in the winter. And I think hopefully the surge will not be as predominant as what we had back in April. But at the same time, with the flu, is going to complicate issues because the patients are going to have symptoms which is going to appear like flu or COVID, and that would require increased capability of our testing, our more safety measures. But Hartford HealthCare is very well prepared to manage that, and I think I would imagine the most system and hospitals are at this time as well. We have, as you know, we've done more than 116,000 testing across Connecticut. Last 10,000 of the cases testing we've done, we've seen a positivity rate of almost about 0.5%. So the prevalence at the moment is very low in Connecticut, and that is a testament for all the good work everybody's been doing. I think we all have to be cautious as we go forward to take the mask and other precautions very seriously.
Great advice. Keep doing what we're doing. Dr. Kumar, thank you so much for joining us. We appreciate the update.
Thank you.